Well, on this historic day of the Senate passing the health care bill, it's worth taking a look back at how this has evolved over time and specifically how the president has weighed in on this particular issue as well. With regard to universal health care, here's what he said.
That means passing universal health care because people are being overburdened and unions are having to spend all their time negotiating to keep health care benefits that they've already won instead of negotiating to improve their wages and benefits for the future. That's wrong. That's going to change, and we've got to have a system where every single American can get health care that is at least as good as the health care I have as a member of Congress.
It is fair to say that this is not going to be universal health care, at least not the Senate bill, the way it's crafted, and not in the way that most people think about universal health care. A better way to think about that is really looking at a couple of different terms. This is more like universal access, trying to give people access to health care insurance who otherwise don't have it. 94%, that is what the predicted percentage of the country is that will be insured if this bill goes all the way through. And finally, the word mandate is a word to keep in mind as well, a controversial one certainly, but part of the Senate bill to try and increase the numbers who are uninsured. Take a look specifically at what this means. There would be financial penalties for the uninsured. It would also require employers to offer insurance, and there would be an expansion of Medicaid for people under the age of 65, expanding Medicaid so that people up to 133% of poverty level could still qualify. Now, again, with regard to mandates, as you might imagine, this is a controversial issue. Some people have gone so far as to call this unconstitutional, this idea of mandating that people buy health care insurance. So that's still going to be worked out. Another big issue was with regard to prescription drug costs, a huge part of the health care budget overall. Different strategies to try and address this. This is what the president said last year with trying to lower those costs.
Then we'll tell the pharmaceutical companies, thanks, but no thanks for overpriced drugs. Drugs that cost twice as much here as they do in Europe and Canada and Mexico. We'll stop drug companies from blocking generic drugs that are just as effective and far less expensive. We'll allow the safe reimportation of low-cost drugs from countries like Canada.
Now, simply put, that reimportation, it's not part of the Senate bill. It does not look like that's going to happen, and it's not going to be a strategy, at least not as part of this bill, to try and lower costs. This has been a big issue, particularly for the AARP. This is a constituency that used a lot of medications. They were really banking on this idea of trying to lower those prescription drug costs and advocated heavily on behalf of this reimportation clause, but it seems that some of the lobbying from the pharmaceutical companies and the FDA saying we can't guarantee that these medications are safe when they're reimported has sort of killed this, at least for now. Talked to the White House specifically about this, and they say, look, it's not part of the bill, but it could still happen in the future. They also point to the exchanges as a place where people could get prescription drug coverage who may not otherwise have it now. And they also talk to this idea about shrinking what's known as the donut hole in Medicare Part D. They say people pay a certain amount for drugs, then they go uncovered for a while, then they get coverage again. And that's what that donut hole refers to. They're talking about shrinking that. But again, reimportation, as the president outlined it, is not going to happen. We're going to cover a lot more of these issues, specifically look at the evolution of healthcare overall, where it's been, where it's going. Back to you for now.